Thank you very much for having me here today. I am Dr. Pius Muzzazzi, a pediatrician from Tanzania. So I am going to talk about today my experience in Tanzania, the challenges, the pitfalls, uh, what Tanzanian doctors and healthcare providers face. So as the title reads, that I'm going to talk about the pitfalls in the diagnosis of type 1 diabetes mellitus, a Tanzanian experience. So let's look at the burden of type 1 diabetes mellitus. So type 1 diabetes mellitus accounts for approximately 10% of all the patients with diabetes in the world. And by 2021, globally, there were like about 1.2 million children and adolescents who were less than 20 years with type 1 diabetes mellitus. And this condition is growing very fast. So it is estimated by 2040, if no serious measures are taken, we may rise to about 17 million people with type 1 diabetes mellitus. And for every 2 people living with type 1 diabetes mellitus, we miss a third one who should be alive. You know, most of these people, and especially the adolescents and the children, die from this condition. And how does it look like in Africa? So between 2011 and 2021, there has been a 5-fold increase in type 1 diabetes mellitus among children and teenagers below the age of 19 years. And this is according to WHO. So it started around 4 per 1,000 children to nearly 20 per 1,000 children. So why do we see this surge within 10 years, 5-fold increase? So these are important questions that we need to ask ourselves. Are the new cases increasing, or is it the healthcare seeking behavior has improved, or maybe there's an improvement in health care provision? So there are questions that every health provider, has to ask himself or herself. So now let's come back to my country, Tanzania. So it is estimated that the incidence rate of type 1 diabetes mellitus in Tanzania ranges between 1.5 to 1.9 per 100,000. Now, you can see this is a bit lower compared to some other countries where it is, the estimates are much higher. Look out at Australia. It is estimated to be 23 per 100,000. Ireland, around 50 to 100,000. So again, we ask ourselves, is this Tanzanian incident rate correct? Why does it seem to be lower compared to other countries? Is it due to different genetic factors, environmental factors that maybe children and adolescents with, in these other countries are more susceptible to type 1 diabetes mellitus compared to some of the African countries, including Tanzania? Could it be higher than this? We don't have many studies that show the prevalence of type 1 diabetes mellitus in Tanzania. You go to most of health facilities, you don't find data about type 1 diabetes mellitus. And sometimes maybe it's because of we miss the diagnosis of type 1 diabetes mellitus. That's why at the end of the day, we have lower incident rates. And type 1 diabetes mellitus actually has an impact to health lives. It takes a lot of health lives. Take an example. An average 10-year-old Tanzanian enjoys 71 health years of life. Now, if this teenager develops type 1 diabetes mellitus, on average, this teenager or child will lose about 49 of those health years. So you can see how big this burden is. And it is estimated that we have about 22,000 people living with type 1 diabetes mellitus in Tanzania, and 47,000, around 47,000 of them have already died. We expected them to be alive today if everything was fine. And we see a good number of challenges when dealing with type 1 diabetes mellitus. Public awareness is still an issue. Still, people do not know the signs and symptoms of type 1 diabetes mellitus. And as you know, it is still not known that it is, people don't believe that children or adolescents can get diabetes mellitus. So there's limited public awareness. Symptoms like polyuria, polydipsia, or even weight loss are not very common to most people around this country. Another factor is lack of type 1 diabetes mellitus knowledge to healthcare providers. So you can imagine, we have some parents bringing their children to the health facilities, but a healthcare provider fails to recognize that this child has type 1 diabetes mellitus. So we miss the diagnosis, and there have been cases that a child with type 1 diabetes mellitus is misdiagnosed to severe malaria, urinary tract infections, pneumonia, meningitis, and other common conditions around here. So another challenge is the access to screening tests. You know, most of health facilities lack these screening tests, like simple as glucometers, the HbA1c testing. So this makes it difficult for the healthcare providers to diagnose type 1 diabetes mellitus. So we have these cultural beliefs and behaviors that also make it difficult, you know, to pick or to get these children and adolescents early enough. For example, we have seen that most of these children, one of the commonest symptoms is polyuria. You know, polyuria is passing a urine, you know, more than normal. You see, the frequency increases. So most of these children will end up with bedwetting when they sleep, especially. So, you know, in most areas of this country, people believe that bedwetting is always about, you know, bad developmental, you know, milestones or poor developmental milestones. So they concentrate on teaching their children how to prevent this, but they don't take these children to, you know, the healthcare providers. And there is another challenge of the health care system. The healthcare systems are fragmented, and the infrastructure does not support care for most of chronic cases, including type 1 diabetes mellitus. So we have issues in this. The main issue is the late diagnosis of type 1 diabetes mellitus. Late diagnosis usually leads to very serious complications or even death sometimes. So we have seen complications, common complications like severe hypoglycemia. This is very low blood sugar level. We have a complication called diabetic ketoacidosis. You know, this is the complication that follows when blood sugar level is very high, and most of children present with what we call DKA, and this is life-threatening. And the two are the leading causes of death in children with type 1 diabetes mellitus. And most times they are not diagnosed in time. But also we have cases of near misses. Yeah, I have an experience of visiting a certain hospital, finding a child who is unconscious, who is being treated for malaria, and the ward did not have a glucometer. And this child was, you know, almost gone. Yeah, at the end of the day, we managed to get a glucometer and diagnosed that this child has type 1 diabetes mellitus with a complication of DKA. So we have a lot of near misses experiences. So we believe that together we can change this story. How can we do it? By improving the healthcare infrastructure. You know, if we upgrade our already present healthcare facilities, especially in the rural areas, and ensure the availability of all diagnostic tools like glucometers, HbA1c tests, and more than that, this should go hand in hand with educating the healthcare providers. Not everyone understands type 1 diabetes mellitus. So I think it's high time to conduct campaigns, you know, seminars, raising awareness about type 1 diabetes mellitus to healthcare providers. And policy and advocacy is very important, involving the ministry, the government, and also it's high time now for the healthcare providers to do more research. You know, as I pointed out earlier, that, you know, look at the incident rate in Tanzania compared to other countries. It looks very low, but we believe it's because we do not have data, we do not do research. And if we do all this, I think we can change the picture of type 1 diabetes mellitus and help as many as possible children and adolescents. And this marks the end of my presentation. And if you guys have any questions, you're welcome to ask. Thank you very much.